I want to talk a little bit about expectations of results. Patients should have very high expectations of their surgeon and of their results and of the ability to do surgery safely with low complication rates. When patients come in for a consultation, they may list a procedure, but I'm going to evaluate the whole body and I'm going to make recommendations on really providing the highest level result with the best quality result and sort of the best bang for the buck. And during that process, we're going to talk about expectations. What are the determinants of expectations for the results? There's really three major ones, okay? Number one is your plastic surgeon. That is going to be your most important factor in determining the quality of your result and the safety, okay? After that, the result is going to be limited by patient factors, mainly patient tissue factors, okay? So what does that mean? That means that a patient with stretch marks and very poor quality skin will not have the same result as a patient who has tighter tissues and thicker skin, okay? And so what determines patient tissue characteristics? Well, there's multiple factors. If you've lost a massive amount of weight, your skin is going to be stretched out and poor quality, almost as if it's aged. So age would be another factor. So the older we get, the thinner our skin gets, and the poorer the tissue quality, and the more difficult it is for your skin to hold that tension long term. Higher BMI will lead to a poorer result because of the thicker tissue of skin, okay? To some degree, too low a BMI, less than 21, could lead to some issues, but obviously any higher BMI is much greater an issue. And over a 30 BMI, the results are going to deteriorate quickly as they go up. Likewise, smoking history is going to decrease the quality of your tissues, or overexposure to skin where you have wrinkly, bad skin like you see on people's faces, for example, okay? So specifically, again, massive weight loss patients should not have the expectation that their body will look like a non-massive weight loss patient, all right? And I know it gets very confusing, especially for patients who go to surgeons like myself who work on both massive weight loss patients and non-massive weight loss patients. So the more weight you lose, the more likely your skin is to be deteriorated and poor quality. If you are starting to have stretch marks on your skin, your result is not going to be as good. We can pull you tight. It will feel like it's loose later. The fatty distribution will look worse with looser skin. It will feel like there's always more skin to remove, or the tissue does not sit tightly, and those sorts of things. And so I try to make that very clear to patients, but sometimes I can explain that to them and they still don't understand that. So I want to make sure everybody understands that. So if you're coming to me and you're showing me a wish picture or before and after, it needs to be someone who is similar age, similar BMI, and somebody who's also lost weight to the amount that you have if you're a massive weight loss patient, all right? An analogy would be a woman who's getting a breast augmentation, all right? If you're needing a breast lift, your result will never be as good as somebody who does not need a breast lift, okay? So if you're coming to me and you're showing me pictures of breast pictures, you should not be showing me young women who didn't need breast lifts who have breast augmentation, because that is not a similar procedure to what you're having done. So keep those things in mind. Instagram is great. Someone like me tries to be honest and show you lots of pictures during surgery, scars, standardized pictures, but you should be studying standardized pictures, not Instagram pictures for the results, but standardized pictures. And if your surgeon doesn't have standardized pictures of your procedure, that is not the surgeon for you. There should be a lot of those pictures, and you should have a really good idea of what your results should be based on those photographs. So keep that in mind, and you'll have a great result and be very happy. Thank you.